Good afternoon, class. My name is Brianna Johnson, and my topic is Should shock therapy be used to treat mentally ill patients? Did you know that according to an article published in the Journal of Royal Society of Medicine that 83% of patients showed improvement after the ECT treatment, while 49% of patients had a remission rate? ECT, or electroconvulsive therapy, is when an electric current is passed through the brain to produce an epileptic fit. The types of treatment include unilateral and bilateral. It has been beneficial for people who suffer with severe depression, catatonic stupor, mania, psychotic depression, and schizophrenia. Shock therapy has been an effective and long-lasting result when it comes to a more effective way to treat these disorders. Shock therapy should continue to be used in the medical field. According to an article in Recovery Ranch, ECT is much safer now due to low electrical currents used in the procedure. The procedure has advanced since it was first introduced in Italy in the late 1930s. We now have anesthesia, which is given to the patient alongside a muscle relaxant in order to numb the patient as much as possible in order for them to experience as little pain as possible. Some side effects of the medicine used to treat schizophrenia include dry mouth, constipation, blurred vision, drowsiness, etc. Not to mention, according to Dr. Michael Rosen of Eternal Medicine, treatments for schizophrenia alter how the brain works and communicates with the rest of the body, affecting the body's neurotransmitters or the chemical messages. On the other hand, the side effects of ECT include nausea, headache, jaw pain, muscle ache, but those can be treated with over-the-counter medicine. In recent studies, according to Larry R. Squire of Healthy Place, memory loss has been associated with bilateral and unilateral ECT and showed that memory loss is closely associated with the temporal lobe dysfunction, which is why unilateral is used over bilateral ECT. On the bright side, with the treatment being safer and having anesthesia, people are starting to perceive that ECT is not how TV and movies portray it. ECT benefits people who cannot or will not take prescription medications due to the side effects of the medicine they are currently taking. A success story with ECT is by a man named John Wyatt. He was under observation in regards to behavioral acts before and after the treatment. He was not active and kind of like in a vegetative state before the treatment was given to him. After the treatment, he was active, and the members of the family's quote said he was like an old self. He was like his old self again, being social, getting jobs, things that they thought he would never do again. Another success story is by a lady named Catherine Kitty Dukakis. Her story is very popular in the ECT community. She shared her story before and after her ECT. She stated that she was battling drug and alcohol addiction, and it was not until she did her research and discovered ECT, or electroconvulsive therapy. She also proclaimed that madness no more, electrical shock is quietly during being resurrected as a recessive wonder that someday could could be right up there with penicillin and Prozac. The success stories of shock therapy demonstrate how much of an impact this treatment has and how the treatment can improve their disability, as well as gave them another method that lasts longer than any medicine that they have taken. The misuse of ECT has given the whole treatment a bad name. Movies like One Who Flew Over the Cuckoo's Nest and American Horror Story Asylum have displayed ECT as hazardous and a cruel procedure. In 2011, according to ECT statistic article by Victoria in 2012, 65% of all ECT treatments were administered to patients who had consented to their own treatment, while 35% were involuntary and were authorized by the psychiatrist on their behalf. They stated that it shows that insane asylums only use this procedure to punish the patients when they act out for simple amusement, according to Al Holtzwitz and Scott Lenstenberg. The truth about on the ECT truth about on the contrary, ECT has been the most beneficial treatment that has long-lasting effects, and death is extremely rare. The positive side effects weigh out the negatives due to the long-lasting effects and the patient aftermath stories. ECT has had a more success story than any antidepressants or any other treatments that have been used to treat these disorders in the medical field. Throughout the years, people have had a consistent struggle when it comes to their disorders and schizophrenia. ECT has been a, quote, miracle drug for those who do not react to antidepressants and other treatments very well. Patients are always wondering whether or not certain procedures will work and the side effects. Shock therapy has many side effects, but all treatments and drugs do. It just so happens that ECT has minimum side effects compared to the drugs that they have used over the time to treat their disorders. Therefore, if you want a more effective and long-lasting results, then ECT is the most suitable and should be continued to be used in the medical field. Thank you.